Hi everyone and welcome to this tutorial brought to you by OSCE Stop. Today we will be going through cardiovascular history taking and discussing how to take a cardiovascular history from a stable patient. So here is your scenario. Mr. Lane comes to A&E where you are the FY1. He is a 62-year-old gentleman who presents with a 3-hour history of shortness of breath, central crushing chest pain and sweating. Please take a cardiovascular history from this man. So first things first, you would want to go in and introduce yourself. Make sure the patient is stable, and if they are, get their consent to take a history. Ask the patient to describe their symptoms to you, then follow this up with Socrates. So you want to ask questions about the site of pain. Is it central, left or right-sided? The onset, when did it come on? Did it come on all of a sudden or gradually? What was Mr. Lane doing when the pain came on? What is the character of the pain? Is it crushing, gripping, burning, tearing, heavy or tight? Does the pain radiate anywhere? To the arm or through to the back? Does he have any associated symptoms? Shortness of breath, nausea, vomiting, sweating, any palpitations, dizziness, ankle swelling, hemoptysis or sputum, and any history of trauma? Timing, so when did the pain first start and how long does it last each time it comes on? Does it come and go or is it constant? What makes the pain worse or better? Is it associated with exercise, certain foods, like big meals, his position? Does GTN relieve the pain? Has he taken any analgesia? And severity, how would he rate the pain from 1 to 10? With 10 being the worst pain he has ever experienced. And has he had anything like this before? When thinking about a cardiac cause, you need to make sure to ask about the following symptoms, as this will help to narrow down your differentials. Think about chest pain, shortness of breath, palpitations, syncope, so dizziness, edema, so swelling in the legs, claudication, so do they get tightness and pain in the calves, and varicose veins, so do they have any dilated or tortuous veins in the leg? Next up is his past medical history. I like to use jam threads to make sure I've covered all important causes. This includes asking about jaundice, anemia, MI, thyroid disease, hypertension, rheumatic heart disease, epilepsy, asthma, and COPD, diabetes and stroke. When considering a cardiac cause, make sure to ask about high cholesterol levels and peripheral vascular disease. Ask about hospital admissions, what were they for and when were they, how long for and any outcomes, were they good or bad. Ask about surgery, success or failure, and were there any complications with the anaesthesia. Next up is the medication history. When asking about medications, it is important to get a list of their regular ones. Some patients will bring a printout from home, but you can usually get this from the emergency care summary sent out by the GP, or from family and friends if the patient is unsure. Find out about any recent changes to medications and compliance to these medications. Ask about any over-the-counter medications they are taking, any recreational drug use, and any herbal remedies or vitamins the patient is taking. It is also important in this section to ask about any allergies the patient has, to which medications or substances and what problems they cause the patients. Next up is the family history, and in this section it is important to ask about first-degree relatives, the conditions they have, if they are still alive, or if they sadly died, when they died and what was the cause of death, any conditions that they had whilst they were alive. If you are suspecting a genetic cause, then inquire further about things like Marfan syndrome or cardiomyopathy. In these cases, it is important to take an extended family history. Moving on to social history, it is important to find out whether they are currently a smoker or have been in the past. What did they smoke and how often did they do this, alone or only in social situations? If they drink alcohol, again, it's important to quantify units and the type of alcohol they were drinking. Did they do this gradually over a week or all at once, like a binge? Did they drink socially or on their own? Ask about diet and exercise, housing and mobility. Find out how their symptoms are affecting their everyday life. How do they get around the house, up or down the stairs? Do they have carers or do they manage on their own? If you are suspecting something like endocarditis, then asking about foreign travel can be really important, or any infections they have had in the past. Also make sure to ask about who they live with and the support they have at home. Never forget about ICE. The patient's ideas, concerns and expectations are very, very important. It's useful to find out their point of view and address any concerns they may have before investigating and finalising management plans. So back to Mr. Lane. He describes no palpitations or dizziness. He has a history of unstable angina, type 2 diabetes and hypertension. The most likely diagnosis I would consider at this point is an acute coronary syndrome. I would like to admit and carry out further investigations such as troponins and ECGs. I would start treatment for OCSE and get advice from seniors. In future tutorials, I will be covering investigations and management of patients with cardiac presentations. If you have found this useful, then make sure to subscribe to OSCE Stop. Thanks for watching.